As some of us know, Parkinson's is a disease that can affect the neurons in the brain that work with your motor functions, right? The disease can sometimes be hard to diagnose, it's tough to live with, and April is Parkinson's Awareness Month. So we're going to shed a little light on the disease and talk about where we stand as far as getting some help. We're joined by Mark Piegza. He's the co-owner of SYNERGY HomeCare of the Lowcountry. Hey Mark, how you doing?
Hey, Kristen, how are you?
I'm good, thank you. Kind of walk me through who might be most at risk of developing Parkinson's, or is it kind of random?
Well, it's a little bit random, Kristen. It can be, some people think there's a genetic component to it, and there may also be a lifestyle and environmental component to it as well. So it's hard to tell who's ultimately going to contract the disease.
And I think it's most known by the shaking hands we see most often, but there are so many other symptoms that people who are living with Parkinson's have to deal with, right?
There are, absolutely. So you get the shakiness, there can be loss of taste, loss of smell, difficulty with speaking, especially, they seem to talk very slowly and very softly, difficulty with large movements. So yeah, there are a lot of different symptoms that we see with Parkinson's.
And it takes a long time to get an official diagnosis. Why does it take so long for some patients to get that diagnosis?
Oftentimes it can be slow to progress in the starting phases of Parkinson's, and it can also be confused with other diseases. So it can take literally years sometimes to get a Parkinson's diagnosis.
Where are we when it comes to research, treatments, cure?
Well, cure, I don't think we're that close to a cure at this point, unfortunately. But for treatments and therapy, there are things out there that you can do. There's lots of different exercises, there's nutrition, there's sleep. All of those things are really important for those who have Parkinson's. For example, exercise. The Parkinson's Foundation does recommend at least 2.5 hours of exercise a week as a way to help combat and manage some of those symptoms that Parkinson's presents.
And is there a prevention aspect to it? And I know maybe not so much prevention, but maybe things that we can do to keep ourselves healthier longer, or to stave off those symptoms a little bit longer.
Definitely. Well, exercise is one of them. Diet's another one. Getting plenty of sleep, and making sure that you monitor those things. And that's one of the things that we try to do when we have clients that have Parkinson's. When our caregivers are in the home, we try to make sure that our clients are getting that exercise, that they're getting the support that they need, that from a mental standpoint, they're playing games, maybe doing cooking together where they can use their minds and also use their bodies to keep themselves active. So there's lots of different things that you can do to at least manage the disease and to improve your quality of life.
And let's just talk, you mentioned the caregivers. Let's talk about the caregivers for just a minute, because you need some special skills as a caregiver for someone with Parkinson's, I would imagine, to handle the way the disease progresses over time.
That's right. And that's one of the things that we always try to do, is make sure we match the skills of the caregivers with the needs of the clients. So when we have clients with Parkinson's, we make sure that those caregivers are trained in how to handle Parkinson's clients. A lot of it is making sure that they do their exercises, that they're engaged mentally, but there's also a safety issue. They can be a fall risk, so you want to make sure the caregivers are trained in maintaining stability and that sort of thing. So yeah, there's definitely some training that they need to undergo to make sure that they're a good match with a client that has Parkinson's.
I would imagine a phone call to your organization or any organization in our area that could kind of get that ball rolling is important to ask the right questions, right?
It sure is, absolutely. And one of the things that we always do is when we get a phone call, then the next step for us is to go to the home of the client, meet with them and meet with their family, be able to really understand what the needs are and be able to assess them from a visual perspective as well. I think that's critical, because otherwise, you don't want to be putting a caregiver into a situation where they're either not trained well or they're not going to be able to help the client. So that assessment is important, and it also gives the family and the client a chance to ask questions that are important to them.
Sure, sure. Mark, thank you so much for hopping on with us today. I think a lot of families can relate, or they're just starting their journey with this, so hopefully this helps them. Good to see you.
Thanks, Kristen.
All right, take care. Have a good weekend.